All right. Hello. Welcome. Good evening, good afternoon, good morning, wherever you are in the world. Thank you for joining us. I wanted to start off with a few housekeeping matters first. We would love to know where people are coming in from, so please type in the chat box your location. And second, we will be welcoming questions for our speakers. So if you have a question, please enter that into the chat as well, and I will pass that along to our experts. I am Amanda Pomeroy-Stevens. I am the project director for the USAID-funded Building Healthy Cities project at JSI. BHC, as we call it, is a USAID-funded learning project that works in 4 growing secondary cities in Asia to embed health considerations into urban planning. At the heart of our model, we think about 3 core values: multi-sectoral engagement, citizen empowerment, and data-driven decision-making. One of the key outcomes of this project is working to improve health equity in urban settings. So we wanted to host this chat today because World Cities Day is coming up on October 31st. And this year's theme is about valuing our communities and our cities. In cities around the world this year, we've seen pictures of empty streets because of COVID-19, heard celebrations of our frontline workers, and seen great examples of neighborly kindness. However, as COVID-19 has spread, we've also seen how certain communities are affected more severely than others, highlighting underlying health inequity. One example is that those who are of the lower socioeconomic status are often those who are also our essential workers and face increased risk of exposure. But they also have less access to healthcare, riskier housing situations, and in some cases, less access to clean water and sanitation. Many of these underlying disparities can be prevented through more equitable distribution of resources. So today, we're going to talk about some examples from JSI where we are tackling urban health equity issues and some of these underlying factors. JSI works both US and abroad, and so we thought it'd be nice to showcase projects from both locations and compare and contrast some of these approaches. Joining me for this chat today is Jeremy Cantor, who is a senior consultant for JSI and a project director based in California, and Afdhal, our city project officer for BHC in Makassar, Indonesia. Good morning and good evening to you both.
Hi. Good evening.
So my first question is for you, Jeremy. Can you tell us a little bit about where your work takes place and some of the key issues you work on related to urban health equity?
Sure. Thanks, Amanda. So right now my work takes place from this shed in my backyard in West Berkeley, California. But usually most of my work takes place in communities across California and is focused on creating partnerships and collaboratives that have the commitments, the resources and strategies to move the needle on health equity issues. I'm definitely less focused on any specific health or social issue, diabetes, housing, et cetera, and more on kind of the capacity building and resource development to do work across issues. One significant area of focus for me in the last couple of years and looking forward is how to engage healthcare organizations so that they can work effectively in partnership with local collaboratives, local public health departments, community-based organizations on health equity issues. Because from my experience, impactful health equity work, it really requires a careful analysis, connecting the dots between illnesses and injuries and underlying issues such as economic opportunities, access to healthy food, as well as a long-term commitment. You know, these are complicated, deeply rooted issues where the solutions are often going to be around systems change, environmental change, policy change. And that requires participation from multiple sectors and organizations in order to get to kind of the scale of response that's necessary.
Great. Thank you, Jeremy. One more question. Can you share an example of a project you're working on that focuses on improving health equity?
Sure. So for the past 5 years or so, I've been working on financial sustainability strategy with an initiative called the California Accountable Communities for Health Initiative. It's funded by 7 philanthropies here in California who combined their resources to support 13 sites across the state who are creating cross-sector partnerships focused on a priority local health and equity issue. And one of the sites I've been spending quite a bit of time with recently is the Peace Partnership in East San Jose, California. East San Jose is a predominantly Latinx neighborhood with a history of underinvestment, situated right next to one of the richest regions in the world, Silicon Valley. And the Peace Partnership's done really, I think, a remarkable job bringing together a range of stakeholders from county agencies, healthcare, and critically community-based organizations and local leaders to develop shared strategies to address and prevent violence and trauma. And they've been very deliberate and explicit about baking equity into everything they do. So from their decision-making processes to goal setting, to the sorts of strategies that they employ, to the way that they use funds and resources, equity is always at the center, and it's a point of consideration and review to really bring that lens. And recently, the value of this kind of partnership has been evident. They've been instrumental in getting resources and support out to families who've been affected by COVID-19. As I mentioned before, it really takes time to do equity work, and it requires this kind of scale and comprehensiveness in order to be successful. So we've been working with the Peace Partnership to develop an impact fund that would support them for 10 years and allow them to both continue their work on violence and trauma and work on the connected issues such as economic resilience, affordable housing, and other big issues that shape health, well-being, and equity at the community level.
Great. That sounds so interesting. Thank you. I'm going to turn to Afdhal now, and I'm going to ask you the same question. Tell us where your work takes place and some key issues you're tackling around urban health equity.
Sure. Thanks, Amanda. I'm working for the BSc in Makassar City, South Sulawesi, Indonesia. As our assessment through the systemic approach, we are working on the 3 main issues. First is about policy and leadership. Second is data-driven decision-making. And the third is equity access and community participation. And this third issue is concerned on how the BSc create the equity for urban health development in Makassar City. What we are doing is to initiate multi-sectoral collaboration to improve health, especially in the vulnerable group. Some of the key issues in this collaboration are garbage management, water and sanitation, and also healthy behavior.
Great. Thank you. I'm going to pull out a specific example. So in Makassar, I know I've been struck, and the project has been very interested in the city's Healthy Alleys program. Can you just describe that for us and how it touches on health equity issues? And then maybe talk about some of the ways that you are expanding this Healthy Alley work through BHC to other cities.
Sure. There are about 7,500 alleys in Makassar. That's populated area, poor sanitation, and also lack of awareness on clean and healthy life behavior there. So to address these issues, the government then initiated the Healthy Alley program. So Healthy Alley is the alley where the residents meet the health indicators, including clean and healthy life behavior, like be attended by health workers, exclusive breastfeeding, anthropometric measurements for children under 5, clean water, personal hygiene, healthy sanitation, free mosquito larvae, and also daily consumption for vegetable and the fruits. So the health department or the community health center, we call it here by Puskesmas, initiated a community-based teamwork to collect the data related to those indicators. So this teamwork was also trained to persuade people in their neighborhood to achieve those health indicators. And then from now, there are around 180 healthy allies in Makassar city as they replicate this program to every year through 46 allies in Makassar. So this improved the equity of good quality of health with lower risk of disease that not only identically coming from luxurious residential area, but as you know, but also even from the small alley. So regarding the BSC4 to replicate this program, as I mentioned above about the initiating multi-sectoral collaboration to improve health, especially in the vulnerable area, the BSC is intended to replicate this also in the island, the remote area. It's just around 1 hour by boat from the Makassar mainland. We have signed the joint charter with multi-sectors to address some of health issue in this island, including expanding healthy LA. Furthermore, in terms of expanding this healthy LA in the other BSC cities, we have invited the city officials from both in Indore and also Danang to directly observe and learn how to initiate and replicate this program also in their own cities.
Great, thank you. While we're waiting for questions from the audience, I wanted to ask each of you a question. So Jeremy, hearing this little tidbit about the Healthy Alley program and the BHC program, is there any parallels that you see with your work domestically with this work that JSI is doing internationally that might be interesting around the issues of health equity?
Yeah, for sure. I mean, I think there are a lot of parallels, and I'm really excited to hear about the Healthy Alley project. I think Afdhal talked about the kind of the community engagement piece, which I think is a consistent theme in health equity work in the United States as well. Is how do you kind of do that in a meaningful way? Actually, that's beyond engagement, but is actually kind of partnership and power sharing and sets up a different relationship, right, or a genuine power sharing arrangement where community residents are really driving project. And I think that emphasis on the kind of measurement and indicators is really key, and something that comes up a lot in my work and our work domestically is sort of how to set targets, and right, because that's often where the energy and where the work's going to go, and how do you do that in a way that really elevates equity and aligns with sort of the community interests and gets you to, I think what often happens is if you don't do that is you sort of end up doing kind of short-term, quote, low-hanging fruit, which can be a good momentum builder, but without really thinking carefully about the indicators, you can kind of lose that longer-term, really transformational equity vision for the work.
Yeah. So then Afdhal, I'm going to ask you a similar question. Jeremy described this really interesting model of funding that's looking multi-sectorally and thinking about equity as part of its investment strategy. Is there anything that you found particularly interesting that could be applied to Makassar or work more broadly in Indonesia from what he's described, particularly around health equity? Yeah.
So around health equity in Makassar, related to the BSC effort, actually, this is around multi-sectoral collaboration. As I mentioned, we have encouraged all sector also to sign a joint charter. So this is also means that they will invest to improve also health equity, especially in the vulnerable area. So the investment, not only the material side, it can be also something like community empowerment, also something like addressing health problem, also specific health problem. So we have break down the health problems in this vulnerable area. So many problems here: that water, garbage issue, sanitation, and etc. So we encourage the multi sectors to can focus on one of the specific area, and also other sector can focus on another area, another topic, another field, like water or garbage. So these complex problems can be solved by multi-sectoral collaborations. Everyone can invest in that. But specifically for the Healthy LA, this is also actually encourage other sectors like private sector specifically also invest on this. So not only government here. So government, the communities also invest, and also NGO, of course.
Yeah, great. Thank you, guys. Well, I think we're just about out of time, but I really appreciate you joining us from across time zones. Oh, we have one question coming in from the chat. All right, so it's for Afdhal. He's asked about informing about the sources of funds or money for replicating the Healthy Alley initiative in other areas, including the island.
Okay. So thanks for Dr. Damodar. And as I mentioned, actually, the source of funding, this is coming from the multi-sector's own budget. So let's say, I'm going to say some of the sectors have signed the charter. So for example, the environmental health and environmental department, and also social department, health itself also, and other NGOs like the UN organization. So as I mentioned, we have built down the problems here, including also the Healthy LA. So in this Healthy LA, as you see, there are many concern here. Okay, as I mentioned, there's something like maternal and child health here, and also sanitation, factor related disease, not non-smoking or something like that. So these sectors can take specifically which one of the area they can focus on and address for this island. So this is something we call it investment, but as you know, investment not only about money, it's something can be the effort to address a specific issue in this island.
Great, thank you. Well, we are out of time now, but this has been a great chat. I want to thank again our speakers and our audience for joining us today. Please remember that World Cities Day, which is about healthy cities in a way, is October 31st. And you can check out jsi.com for more information about both of the projects we've talked about today and other projects that we do around health equity. Thank you all, and have a good morning, evening, or day.
Thanks. Bye.